Hey, today we're gonna talk about shoulder dislocation and its prevention. So first we're gonna talk a little bit about the anatomy of the shoulder. I'm gonna divide these little anatomy segments by different layers of the shoulder. So what we would first see is a first layer mainly built by the connection of the humerus, which is the long bone in our upper arm, and the scapula. They will connect in what we call the glenoid cavity. So we have to understand the shoulder as a ball placed inside a small cavity. It's pretty much the most mobile joint in our body. And in our body, we have a relationship in which the more mobile a joint is, the less fixed it will be in its position, or said in another way, the more likely it is to dislocate and get out of its natural position, which is what happens with the shoulder. Then, after the bone, we would find a second layer in which we have the soft tissue that protects the joint, or the ligaments. These are placed around the different joints of the shoulder, protecting it, and they act as a second barrier, centering the humeral head in its normal position. Then, as a third layer, we have the first muscle layer. You may have heard about this one. It's called the rotator cuff. It's a group of muscles that go around the humeral head, and their main job is to center it and to push it against the glenoid cavity so that it doesn't move around. And they also have different functions which we will talk about later, but they are mostly external rotators of the shoulder, and some will be internal rotators of the shoulder. And then our last layer of protection for the shoulder will be the more external protection layer. This is mainly made by the pectoral muscles, by the biceps, by the deltoid muscles, and the latissimus dorsi, which is an internal rotator, a big muscle that comes from our back and inserts in the humeral joint. These are all really powerful muscles that, as you can see, they cover the bone structurally. So if the bone happens to dislocate, it has to go through all of these layers of tissue protecting it. So how can our shoulder dislocate? Which are the types of shoulder dislocation? As you can see, this is the normal shoulder position, which we talked about, where the humeral head is pushing against the glenoid cavity. This is an anterior dislocation. This is where the humeral head goes forward. This is the most common kind of dislocation. We will talk about this a little bit more later, but one of the main common positions in which our shoulder will be dislocated through an anterior motion will be in external rotation and abduction, which is probably the weakest position of the shoulder. Then our shoulder can also be dislocated posteriorly. It's not as common, but can also happen. And then the least likely way, an inferior dislocation, which happens in horizontal planes of movement, which happens way less often. And as a last type of dislocation, there's multidirectional, which is the combination of two or more kinds of dislocations. Not at the same time, but more like in an instability process where the shoulder tends to go in, for example, an anterior motion and an inferior motion. So who is this video for? I would say consider training seriously for your shoulder if you are in one of these groups. First, it is recommended for general population, but especially for people with shoulders with laxity, with lots of range of motion as a preventive measure to avoid future dislocations. It's really recommended for people with shoulder instability. The difference with shoulder instability and shoulder laxity would be that in shoulder instability we have pain and we have actual movement outside of the natural joint path, meaning your humerus head goes out of its socket, whilst in laxity it doesn't. It has way more movement than normal, but it doesn't go out of its socket. So training is also considered as a first measure if dislocations aren't repeated in certain amount of time. If it's just been one shoulder dislocation process, then rehabilitation and training is recommended as a way to prevent a future dislocation and surgical procedure. And then as a last group, it will be people with shoulder instability that had actually had surgery as a protective measure to avoid future dislocations and to reinforce the damaged tissues. And one thing I want to say regarding this is that strength training is not magical. It's a key element for this kind of pathology, but there will be tissue damage with every dislocation. Every time the shoulder goes out of its natural place, of its natural socket, it will destroy something. It will destroy a part of the bone, it would destroy ligaments, it will destroy the joint capsule, it will destroy muscle tissue. So the idea is that depending on our medical diagnosis and what the doctor decides, we understand that tissue has been damaged, that we can correct and support the loss of function by some of these damaged structures, but sometimes it gets to a point where there's no other solution but to get surgery. So, why is strength exercise the gold standard for prevention? Why am I doing this video? The idea is that with strength training, we are gonna reinforce all the tissues that build this structure of layers that we talked about before. So first, the bone, by doing strength training, is gonna remodel and increase in density, which is gonna protect us about injuries that occur when our shoulder goes out of place. So, as we talked about before, the humeral head is placed against the glenoid cavity. What happens is that by doing a violent movement forward or backwards, it tends to break part of the glenoid cavity and have different bone injuries. So by doing strength training, we are protected in this realm. Of course, injury can be possible, but it's way less likely to be as important of an injury as with less dense bone. Then the ligaments, they will also be reinforced. They are pretty much the slowest tissue to get reinforced, but collagen synthesis happens either way if we put resistance stimulus onto a soft tissue. By Davis law, it is said that it will adapt to this kind of stress and demands we put on it. Then the muscles and tendons, maybe the more visual part, they of course will become stronger and they will become bigger, which, as you can see, they will act as a physical barrier, avoiding the humeral head to move in any direction we don't want to. So I tried to put this in a kinda beautiful way, in that our goal with training and prevention is to build a belt of soft tissue where the humeral head is strongly centered against the glenoid cavity and protected against unwanted movement. We basically want to build an armor around our shoulder joint so that it is always protected. So I put this image of an average shoulder. As you can see, you can literally see the humeral head. Imagine the difference it makes to actually have trained shoulders with a physical barrier to protect them from injury. This is just an image of the pectoral muscles. As you can see, they insert in the humerus, and thus having big pecs will pretty much by definition build a huge strong string that protects your joint getting out of its original place. And then, just for comparison, I want to show like a visual representation of which shoulder do you think is more likely to go out of place? The shoulder in the first image or the shoulder in the second image? So what do we include in our training program? Let's see, we've had our shoulder go out of place once and we are kind of scared it will happen again. We are in one of these groups that is gonna take it seriously and try to avoid our shoulder injuries. So the idea is to consider a complete upper body program that includes this kind of exercise, but also it's not limited only to this. The idea is that any upper body movement is gonna be helpful as long as we are applying resistance to it. So we want to have raw shoulder strength exercises. This is your typical presses, your bench press, your push-ups, your lateral raises, whatever kind of exercise that uses your delts for strength is gonna be fine. And also your lat exercise is really important. The lats are an internal rotator of the shoulder and they have a really thick tendon, which is really important to get stronger. So any lat exercises like pull-ups, pull-downs, rows are also gonna be effective. This is gonna be the core of our training program. We also need to add external rotation exercises because these are the rotator cuff muscles we talked about. These are a layer of muscles that will only be trained through external rotation exercises. Internal rotation will be trained with the previous exercises with raw shoulder strength, but external rotation is something we don't really do in our daily lives unless we purposefully train it. So cable exercises like the one you see in the image, or you can also do it lying on your side with a dumbbell. They are great for reinforcing the external rotator structures. And also, as we saw before, being anterior dislocation the most common, which happens by the mechanism you are seeing in the picture, by external rotation and abduction. We could consider this as the weakest position of the shoulder, so reinforcing it is gonna bulletproof our shoulders for future injuries. We also want to train stability, making our shoulder adapt to different situations. In this case, I put an example as shoulder taps. You can do whichever you like. And also plyometrics, in this case, explosive push-ups. Just whatever case in which your shoulder has to contract really quickly and receive impact and control force is gonna also be beneficial. Of course, this will be a more advanced part of a program. Last point I want to talk about is applying these concepts to different body regions. So as we said before, the shoulder joint is extremely mobile. It tends to dislocate. It's the most mobile joint in our body. But dislocations happen also in other body parts, especially on the knee joint. So strength exercise, of course, is also recommended in these cases. Just try to adapt what we said to the knee joint, but the idea is the same. We are gonna reinforce the soft tissue in the joint so that it is protected. And as I said in a previous video, strength exercise is recommended for every age and segment of the population. So thank you so much for watching. Here you will have linked one of my previous videos in which we talk about exercise and the recommendations for adults.